Hi everybody, welcome to Beauty Buzz with Lori. So today I have with me Becky, our nurse practitioner. We're going to be talking with Becky today about allergic shiners. So Becky, why don't we start with what are allergic shiners?
Okay, so the term allergic shiners basically refers to when the skin under the eyes gets a little bit darker. And this can happen when we have allergies. I know right now the pollen in Florida has been awful, so it's caused some sinus issues for people. And what happens is the blood under the eyes, it can pool a little bit. It's not draining as well from those tiny little blood vessels under the eyes. Why this is a concern is because normally the area under the eyes, that skin is a little darker to begin with. So when it's combined with this effect from the allergies, it creates that allergic shiner that a lot of people are unhappy with.
Right. So there's a few different things that we can do, such as maybe sleeping a little elevated at night so that pooling doesn't happen as much, and it also allows for less swelling throughout the evening, that fluid gathering in that area.
Absolutely, that can help.
Okay.
Doing a cold compress in the morning can help. Even taking an over-the-counter antihistamine.
Okay.
Those can all help with the allergic shiners.
Perfect.
And there's a treatment that we can do here.
Yes. So one of those treatments that she's talking about is PRF injections. I myself have had a great experience with this, but I'm going to let Becky tell you exactly what PRF injections are, maybe starting with what that stands for.
Okay, so the PRF stands for platelet-rich fibrin. This is an all-natural treatment. We actually would draw your blood and then extract out the part of the blood that's rich in growth factors. And then I can take that and inject it right into the skin under the eyes. And this is really great because it helps stimulate collagen and it can help that skin look smoother and brighter.
How often would one expect to get these? Do you start with a series and then what is the maintenance plan on those?
I typically recommend starting with a series of 3 treatments, 1 month apart. That usually does it for most people, and that's something that you could repeat annually. You could do it every allergy season or kind of whatever works best for you, but that'll help with stimulating the collagen, keeping that skin smooth and bright, and helping to combat some of the effects of the allergic shiner.
Another thing that the PRF injections doing with that is a lot of times we have the deficit in the tear trough area too, which can cause shadows that can contribute again to that darkness under the eyes. And so you do a treatment where you use a filler in the tear troughs and then do a series of the injections as well. Can you tell us just a little bit about that?
Yeah, absolutely. So when we have a little volume deficit under the eyes, that creates a shadow, which makes the skin look even darker than it already is. Concealer can help with the shadow. We can add a little volume there with filler. A hyaluronic acid filler, just a tiny bit in that little volume deficit, can help to resolve the crease and do away with the shadowing.
I know that there was at some point a concern about, people had a concern about putting filler that close to the eye. Can you reassure us that that is a safe procedure?
There are a lot of safety concerns with that area. I use a filler that is approved for use in that area, and I always use a cannula when injecting around the eyes. It has a blunt tip, so the idea is that it wouldn't be sharp enough to pierce a blood vessel.
Okay.
So definitely safety is the top concern. So those things really help to minimize the risk while still getting the control.
And we have before and after photos, and it is actually myself that these are of, because I used to get the injections all the time. I don't actually have to get them anymore at this time. I will as needed. I haven't had to have them in quite a while, but it's just an amazing treatment. It really works. You see a change within about a 2-week time frame of getting the tear trough filler, because I did both of those. I did the tear trough filler along with the injections. Well, thank you, Becky. Did you have anything else you wanted to add?
No, I think that's about it. If allergic shiners or dark under eyes or something that have been bothering you, I'd be happy to talk to you to see if you're a good candidate for these treatments.
Perfect. Yeah. So, and Becky can do consultation with same-day treatments. So make sure you give us a call and get on her books. And thank you for watching.